What I value most about being a NACHC member is the fact that we can come to conferences like the CHI or the PNI or NCFH conference and be around people and meet with people that are like us. When you're working in a community health center, it's really easy to kind of get caught up in your own little world and your day-to-day and sort of feel like you're alone. Then you come to a conference like the CHI and you realize there are thousands of people just like you doing the same thing for many, many thousands of people all over the country, and it's a really good feeling. It's a great organization to be a part of. As a new medical director, the training for new medical directors at the CHI was very, very valuable for me. There were lots of things that I was made aware of during the training that I wasn't necessarily aware of in detail before, and these are things that I'll be able to utilize in my day-to-day, and they'll help me lead my team and be more effective and better. So our health center benefits greatly from the many webinars that are put on by NACHC. I actually participated as a presenter in one just recently myself, but on a regular basis we have the opportunity to gather some leadership people together in our boardroom and learn about various topics, from becoming a teaching center or utilizing certain new services or meaningful use, or endless topics, and it's great because you can assemble a lot of people in your health center and you're right there. You don't have to fly 20 people to a conference and incur that expense. You can utilize these resources right at home, and it's very, very, very valuable. Well, I sort of joined NACHC by accident. I came into the community health center world and became a member through my organization, and now that I've had a chance to attend several conferences and utilize the services available through NACHC, it's a very, very happy accident for me. Going to NACHC conferences and participating in NACHC events, I'd say my network of professionals that I remain in day-to-day contact with is probably multiplied by 10 times. I've established some really, really good working relationships and friendships through this organization, and every conference I attend, I leave with another contact, another person who is in the same situation I'm in, and they might be across the country, but we're doing the same thing, and we can utilize each other as a resource for anything from collaboration to bouncing ideas off of each other. But it's like I said, every time I come to one of these things, at least one person I make a lasting relationship with. That's great. The NACHC staff is wonderful. NACHC staff is the best. I haven't worked with any other professional organization where the staff can compare to the staff at NACHC. Everybody here is really dedicated. Everybody here understands the health center movement and understands what we're about. The thing that I like to tell people is, when you work in community health, you're all about people. That's what we're here for, is for people. And the individuals working at NACHC fully understand that, and it makes things so much better for us as members to be able to just get things done and know that there's somebody out there that's going to make things happen for us. I don't believe that I would be as effective in my position as medical director without having involvement with NACHC. As I've grown as a leader within my health center, pretty much right from the start, I've been in the position to be involved with NACHC conferences and webinars, etc. And without that piece being there, I don't believe that I would be as effective in my position.